Good afternoon. Good afternoon. Good afternoon. Thank you. Trying my woman's voice, my man's voice. Liz, I'm Philippa Howden-Chapman. It's a pleasure to welcome you to another of the public health seminars. And today we feel very fortunate to have one of us, if we're allowed to say that, Dr. Liz Craig, who's an MP in the Labour Party and entered Parliament in 2017 as a list MP. She's one of the few scientists in Parliament, I think I'm right in saying that, and not many with a doctorate, which she did her doctorate in looking at the effect of smoking on neonatal growth. Is that correct? Somewhere around? Perinatal outcomes, sorry, I stand corrected. She is a public health doctor working for over a decade to monitor the health of New Zealand's children and young people. And she saw how chronic underinvestment has played out in the lives of many. 1 in 5 children were living in poverty, with thousands being hospitalised each year for poverty-related diseases. As a Southerner, Liz saw how the same underinvestment was playing out in the regions. Health services were struggling due to lack of funding. State houses were being sold off despite a shortage of emergency housing, and young people leaving the region were leaving the region in search of better jobs elsewhere. Liz's entry into politics stemmed from her belief that every child in New Zealand should have the best possible start in life, and that the government had an active role to play in ensuring all New Zealanders could access the services they need. Liz is currently a member of the Health Select Committee and the Regulations Review Committee, and gave a very interesting roundtable before on how we can help members become informed of things that are the purview of people here. So I look forward to hearing your talk, Liz. And we, yeah, you can give a clap? Yes. If you can make sure you talk.
Okay. Well, thanks, Philippa. It's really lovely to be here and to see so many familiar faces. What I was asked to do is just give some reflections on that transition from being basically one of you guys in terms of working in the health system and also being involved in research, and then transitioning through into being an MP in politics. And so what I sort of called my talk is From Child Health Advocacy to Politics, Reflections on Working for Social Change. And I think just before I start, this little thing here is a brooch that we got given on Women's Suffrage Day last year, when basically 125 years of women's suffrage, and they gave each woman parliamentarian a little brooch, and on the back of it, it had a number, and that was the order in which she was sworn in as a woman parliamentarian. So mine was number 134, which meant I was the 134th woman ever across all of New Zealand Parliament to be sworn in. And I guess, sitting in the debating chamber when I received that, just thinking through, hell, that's an incredible responsibility, because while our time in politics is always short, I think it's sort of up to each of us to try and figure out how we use that to the best way we can. And so I think that's something that we have in our mind, all the time as we are sitting in, Parliament as politicians. But just thinking through for today, what's useful. And what I used to do is, in my previous job, I was a public health doctor, and I can take you through a little bit of my journey shortly. But I used to have to teach trainee interns, and my job was looking at population health and trying to, talk to them about advocacy and how you can try and achieve change, in the bigger picture. And rather than reading any textbooks and stuff, after 10 years of doing that, I tried to distill it down into some key principles. And I guess some of those had been from just sort of my own experiences of trying to advocate and figuring out how to do that. And I think the lessons what I used to talk to them about is, okay, well, when you're doing advocacy, the first thing you've got to do is figure out what is the issue that you're trying to, work on. And then secondly, track back and think about, well, how did we get to the position we are in now? But then, we spend a lot of time doing that descriptive epidemiology, but then it's got to be that next step. Well, given that, what do we have to do to fix it? And that's really thinking about that evidence base. And some of that is the work that you guys are doing, looking at what it is we can do to address particular issues. But then you can't stop there, because the next step then is figuring out who is the key decision maker. that can lead to those changes. So if you want to address child poverty, it's not really thinking about going to the DHB and talking about child poverty, because they do implementation, but you need to be thinking about who's got the actual bigger strategic decision making in that area. Then the next thing is, well, okay, who is that group of people or people we need to communicate with? But then how do we communicate with them? What gets their attention? And then having said that you've got their attention, how do we make sure that they move forward and achieve those changes? And so that's kind of like one slide, but it's about 10 years of thinking through that stuff and trying to figure it out, trial and error. So what I wanted to do is just take you through briefly my own journey in terms of child poverty advocacy, and just sort of where I started out and where I got to. And many of you in this room have been part of that journey with me. I see some familiar faces. And so basically where my journey started is coming back and training as a public health physician here in New Zealand. And I had to do a project as part of my public health training, and I started to hear from people working in the Paediatric Society. And what they were saying is, look, we just got, we're swimming in sick kids. We've got thousands of kids that are coming into hospital, they're sick, and we don't really quite know. We think there's a real big problem here, but we can't quite. If we had more data, we would be able to do something about that. And at the same time, DHBs had just been formed, and they were having to do these things called health needs assessments. So the wonderful idea was every 3 years, you would do this assessment of the needs of your population, and then you would lay out, all the data, and then you would look at your services and think, okay, what's working well, and what do we need to devolve so we can free up that money to do some extra innovative stuff. And the problem was that in child and youth health, children kept falling off the radar because there was no data. And so working with the likes of Nick Baker and Veronica Casey back early in the sort of early to mid 2000s, trying to figure out how we pull that information together. And so the Epidemiology, Child and Youth Epidemiology Service was formed as a result of that work. But very, very quickly, within the first couple of reports, we figured out that actually what the clinicians were saying was true. There were thousands of sick kids coming in for all these preventable conditions. And so this is just a graph that I use a lot. And it's just looking at hospital admissions for bronchiolitis in babies. So babies the first day of life. How many of you guys have seen or looked after kids with bronchiolitis? Yeah, so this is a big issue. So when I used to be in the wards, what would happen is these little kids would come in, they'd all be under 1, they're usually under 6 months, and they used to have trouble breathing. So it's a viral respiratory infection, more common if you've got household crowding, exposure to secondhand cigarette smoke, or if you've got older siblings going to daycare, bringing home infections. And because it's viral, it's not considered ambulatory sensitive. So if you end up going to the GP to get checked up, there's nothing a GP can do to prevent the alter the clinical course, because antibiotics won't help. And so we end up with lots of these kids coming into hospital. And back in the day, it may have changed, some of you guys working in peds now, but back in the day, all we could do was give them oxygen and make sure that they didn't get dehydrated because they were too have too much respiratory distress. And then occasionally we'd end up with babies having to go into intensive care and getting respiratory support. So every year we see about 5,000 of these babies coming in across the country. And as you can see, we've got huge social gradients. So admission rates about 24 per 1,000 for babies in the most affluent areas, coming up to about 150 per 1,000 for babies in the most deprived areas, and much, much higher rates for Maori and Pacific children. And what we saw is this was all across child health. So if you look at this, sort of social gradients, this was on average, any given year we did the analysis, 2, 3, up to 4 times higher for kids in the most deprived areas. If you look at things like rheumatic fever, bronchiectasis, 10, 20 times higher. So across all the acute pediatrics, big social gradients. And so then the question is, well, what do we do about it? Because each clinician looked after each child well and then sent them home, many times into the same crappy house that made them sick in the first place. And so we started to think about, well, how could we actually, achieve change? So it comes back to the next step. Okay, what's the issue? Huge social gradients in child health. How did we get there? And so this is just then starting to look back through, well, where did the origins of a lot of our child poverty situation happen? And this is just, I won't go into the detail of the child poverty measures because they're complex to anybody that knows about measures to explain, but basically 2 different measures of child poverty. And you can see back in the 80s, rates about 10 to 15%, depending on whatever measure you looked at. Then a huge surge in child poverty up in the beginning of the 1990s, and it never really came back down a little bit here during sort of the late 2000s, but then we hit the global financial crisis here and it came back up. But just focusing on what reset the baseline, and this is where we used to get taught in public health that, policy makes a big difference in terms of, health and well-being. And you kind of got the sense when I used to, do my sort of public health training, that if you changed a policy here or here, gradually over time, you might get these incremental changes that led to better health outcomes. But what we did back in the 90s is we made some incredibly big policy decisions that actually changed the whole playing field for children and young people, the subsequent generations, and it made them within 1 or 2 years. And so this was a big transformational time, of which a number of PhDs have been written, as well as many, many books. But what we actually did is a whole range of stuff. So we introduced GST on everything, which meant that people on lower incomes were paying a higher proportion in terms of tax. 1991, significant benefit cuts, and that was, for some of those families, some of the lowest income families in our country, we cut their income. Employment Contracts Act in 91, which changed the way that the unions interacted and the way employment situations were set up, and I've seen not huge increases since in incomes at the lower end of the income distribution. Things like market rates for state houses, and started to look at competitive models for health and education, and the whole framing of welfare changed back at that time. And so, these huge policy implications, and each bit added to that overall jigsaw that I think made it tougher for many families. But time kind of went on. We made those big changes. In a way, we got used to them. And we did have some policies like Working for Families that started to see some improvements here. But what then happened is the global financial crisis hit and child poverty rates went back up. And so those social gradients of bronchiolitis I was showing you, that was actually for that period there. So 2004, 2006, when that graph was made, this was some of the lowest unemployment rates that we'd had in the country in a couple of decades. But the policy settings meant that what was happening is that those social gradients were heavily baked into the New Zealand context. And so a number of us started to get quite concerned. And I think who was in the group with the original Child Poverty Monitor working groups? Anybody here? A number of us got together sort of just as we started to see these unemployment rates coming back up again. Because we're incredibly concerned if we've got really big social gradients at the point where the grass is green, what's going to happen as unemployment rises with the global financial crisis and we start to see families shifting onto our benefit system and doing it tough? Are we going to see big surges in hospital admissions for things like infectious and respiratory diseases? And so a number of us got together in about 2008, early 2009, and we developed up we called it back then the Children's Social Health Monitor, but it subsequently became the Child Poverty Monitor. And what we basically said is that we are going to monitor the well-being of children through this period, because what we're concerned about is that if the GFC hits, we're going to be seeing adverse outcomes and that nobody might notice. So what we're going to do is we're going to monitor a basket of health outcome measures to make sure that children go well through that downturn. But secondly, we're also going to monitor where we are in the economic cycle. And so at the Paediatric Society conference, I think it was back in 2009, a group of us got together, we lit a candle to symbolise that we would continue to monitor this on behalf of New Zealand's children until their economic position improved. And so some of the indicators that we looked at, and I'll take you through some shortly, is just hospital admissions for conditions with the social gradient. We were looking at basically, there was some other things like hospital admissions for assault, neglect and maltreatment of children, and also infant mortality. On the economic cycle measure, we were looking at things like GDP, income inequality, unemployment rates, just to track where we were in the economic cycle, but also some child poverty rates as well. And so what we did is we basically developed up this composite indicator called hospital admissions with a social gradient. And so what we did is we looked at all the acute hospital admissions of kids who were coming in, and we basically said, okay, if it's got a social gradient and we had certain cut points, we said that's sensitive to economic conditions, and so we'll put that in the basket and monitor it moving forward. So as I was saying with bronchiolitis, there was a huge number of conditions that we were seeing with kids coming in with a social gradient. This is an awful slide, but it gives you the idea of what there were. So asthma, bronchiolitis, acute respiratory infections, gastro, skin infections, pneumonia, rheumatic fever. So all these conditions, we lumped them all into one basket. And what we were seeing is about 40,000 of these admissions a year. And then we tracked them through. And what we did find is that, child poverty did increase during the global financial crisis, as you would expect. And we also saw that these conditions also increased. Now, there's some technical stuff, anybody that knows about data, about some changes that happened in terms of the coding during that period. So it made it hard to quantify exactly how big an increase there was. But basically what we're seeing though is still about 40,000 of these admissions coming through each year. So thinking through what is the problem we've got is huge social gradients. We've got a policy settings that basically had their origins back in changes that we'd made in the early 90s that we're continuing through, and then we'd overlaid on that global financial crisis. So that was the issue. But I guess then the thing we had to think through is, okay, if we're going to do anything about this, we can make the government aware of this, fine, but what are they going to do about it? And so I think, and this is where it comes back to, I think, for us as a research community, thinking through and using our thinking and our research to figure out what would you actually do in terms of advocating for change. And so what we started to think through, looking across this range of data, was the underlying thing is we needed to look at how we increase family income, because the bigger puppeteer among all of this was child poverty and low family income. But also a lot of it was, bad housing is what we were hearing in terms of overcrowding because of house prices, housing shortages, and also housing quality. So kids living in cold, damp, mouldy houses. And so we started to advocate for measures to increase family income and also to address housing. And then one of the other ones that we were concerned about was access to GPs and primary healthcare. Because, kids don't just get sick in office hours. Mine used to get sick at 5 o'clock on a Friday night. And you'd always then be worrying about, well, do I sit on this or do I take them to the GP? And for many families, the after hours GP might be $60, $70. And so what often families would be doing is waiting until their child got sicker during those hours and then ending up in A&E, where you end up with potentially a whole range of investigations and things, which is not, ideal in terms of good outcomes for families or the system. So those are the three things that we decided we wanted to advocate for in terms of achieving change. So thinking through the mechanisms of how we did that. So what we did, because I think this is something where you can put one report or one study out and you may get some reporting, say in the media for a couple of days, but then the issue goes away again. And I think this was a big systemic issue that was affecting our whole country. And the question is, well, how do we approach that? And so what we did is that we committed to updating this data once every year. And so every year when we updated the data on the annual anniversary of it, we had a public launch event. And what we did is we sent advanced copies of the information and then the key findings and our recommendations through to the NGO community, the advocacy community, and basically key academics, in the university system. And we just basically said, this is our key findings. And, if you want to put out a, media statement or something, talking about your own experiences in this area and reflecting on this data, feel free. And we also sent the same information through to working out who the relevant ministers were. So Minister of Health, Social Development, Housing, and also the relevant opposition spokespeople with exactly the same thing. And then we put media releases out. But what happened, what tended to happen is that all of those other organisations that were interested in this, they all put their media statements out on the same day. So we'd often end up with 8, 9, 10 different groups and organisations talking about this in the media. And so this is just some of the grabs from you know, this is one of our media releases, and then these are some of the stories that came through. And it wasn't always our own organisation that got the media stories. Sometimes it was other organisations that were doing the TV interviews on the same topic rather than us. But there was just, you know, because there was concern and this was some useful information they could use, we ended up with, on average, people talking about child poverty and child health for about 3 days straight around each of those releases. And then what started to happen around these times, obviously, is then it started to get pick up, you know, in terms of the politicians and the ministers at the time tended to then be asked to comment on that. And so, you know, increasing that awareness that some of the, you know, we needed some policy change. So these are just some of the media stories where various politicians have talked about their response to it. And also what we tended to do is, when we were doing most of the time, it was actually, you know, Labour was in opposition at the point, but there's always debates in Parliament at question time about what's the response to this, what we should be doing. And so over time, what we started to see is that public debate and discourse around it. And it wasn't just what we were doing, there's a range of other people that were also working in this space, working very hard. And I'm thinking about particularly, say, the work of successive children's commissioners, you know, Every Child Counts, Child Poverty Action Group. There's a range of other organisations also working in this space. But what we started to see is that then the political parties started to include these issues in their manifestos. And so this is just a grab from, I think these are 2017, they might be slightly earlier, but, you know, so basically Labour talking about what it's doing in its family package, National talking about what it might do in some areas, and also the Greens children's policy. So again, that translation of research within, you know, this setting, other advocacy groups coming together, getting it up into that public area, and then starting to see that moving through into the manifestos and political party thinking. And so basically then what it meant is that, you know, whatever happens in subsequent elections, you've got those parties thinking through where they're going to go for children. So for me, my own journey, after 10 years of advocacy, I basically started to think that it was time to engage with that political process myself. And so I stood as a candidate for Labour in 2014, and then basically came in on the list as a Invercargill based MP in 2017. So basically I'm class of 17, which we call ourselves, the 17 new Labour MPs came into Parliament in 2017. And so we're coming up to almost the 2-year anniversary of that, because it was September the 23rd, that basically the election was held. And so for me, that journey up for that advocacy point then changed, obviously, as we entered government. So we had, basically the election was on the Saturday night. We were sort of staying up till midnight, and then leaving on 6 a.m. on the Monday morning to go to MP school in Wellington for 2 weeks of training, basically to figure out how to become an MP, while at the same time the discussions were happening in terms of the formation of a government. And so basically then in October, the coalition government agreements were formed. And so we've now got a coalition government working forward. And so that was October 2017. And my journey as a backbencher began. So many of my photos, this is basically, this was an amazing day when the government was sworn in with the Governor-General here, and then the Prime Minister and basically the new cabinet all jumped in a bus back from that signing ceremony back to Parliament. And then this was the reception. It was at Parliament, which was just an amazing day. So there was just people everywhere, all on the balconies and everywhere, coming in to welcome in the new government. And as being a backbencher, most of my photos of such events are usually taken from the back or slightly to the side. But thus the journey begins. And so basically 2 years on, you know, there's an incredible lot of things that we've been doing. And so the first thing, this is a lot of the commitments that we as Labour made and said that we would do in our first 100 days. And many of these relate to children. And so basically, this is just our 100-day plan, pretty much ticked off. So first year of tertiary, was, you know, post-secondary study, free fees, and also increases to student support. Looking at the Healthy Homes Bill, I'll talk about that in a bit more detail. but that was signed off just before Christmas. A whole lot of other areas looking at housing, so not having foreign buyers in terms of our houses. Stopping state house sell-off, also looking at the whole families package. And I can go through all of those, but basically I just want to focus on some of the things that we had been advocating for children and where we've moved in that space. And I think the biggest one, and the one that we struggled with the most in terms of our advocacy, prior to me coming in, was around that whole issue of family income and how we, start to rebuild that for families, because it's so crucial. And so one of the first things we've been doing is looking at increases to the minimum wage. So on average, there was sort of increases of about 50 cents an hour, per year over a period of years, but quite substantive then increases up to $16.50 in 2018 and now $17.70 in 2019. Because I think a lot of families out there doing it really tough and working hard, and it's just about being rewarded, so that if you work a full week, then you can earn enough to support your family without having to be working and still struggling. So putting extra support into that minimum wage, I think, is important. But also this is sort of one of the big moments for me, I think. We came in September 2017, and then for me, submitting in the debating chamber just before Christmas, looking down at this bill that was about to pass, and all the stuff, so much of the stuff that we've been advocating for was passing into the law at that point. And so what we saw, in this families package, there was things like increases to working for families, but also extensions to paid parental leave that we've been advocating for a long time. So basically from 1st of July last year, that extended out from 18 to 22 weeks. And then it's going to go up to 26 weeks in due course. But also the best start payment. And this is something that many people have been looking at in terms of how do we put that extra income support into families in their child's first year of life. So best start, once you finish paid parental leave, $60 a week goes into families for that first year. And then it continues on up to 3 years if you're in a low to middle income. So just that extra money so that families can buy those things that they need, just to stop that whole trade-off. I mean, $60 in the bigger scheme of things, I mean, it makes some contribution, but there's other things we also need to do. So that started on the 1st of July last year for that cohort coming through. So within that 3 years, that means that that whole cohort of up to 3-year-olds will be getting that. And basically, I'm hoping that will make, start to make that real difference for many families. Also increased accommodation supplements because that hadn't gone up for a very long time. And also the winter energy payment. So that comes through to if you're on a benefit and you've got children, or if you're on pension. And that's basically paid over the winter months, $31.82 a week for families. And that just gives them that extra money to be able to turn the heater on in winter. Because I think, thinking through a lot of our respiratory infectious diseases, if you can have a warm, dry home, makes a bigger impact. So that's some of the stuff that we moved on quite quickly. It came in, most of those things, 1st July last year, but it was actually legislated, pretty soon after we got into government, before Christmas the previous year. One of the other things that we did is really focusing on housing. Certainly where I am, and also all around the country, people are really struggling in terms of just huge unmet need for social housing, and also a lot of our rental properties, in a not great condition, and that's leading to, sickness in kids. And so before Christmas that first year, we passed the Healthy Homes Guarantee Act, and what that did is created that platform for creating those standards that looked across not just insulation, because there had been some insulation standards before, but also looking at clean heat source, moisture, damp ventilation, those kinds of things. And there was those of us in the room, and others who've been involved in a lot of this. And I think thinking through just having that bottom line, so that families can say this is the standard, and if it's not being met, then there's things in place to be able to do something about it. And so basically implementation, now the standards have been developed, will be staggered. So from July 2021, private landlords, if they get a new tenancy within 90 days, they need to have things up to spec, going through to by 2024, all rental homes will have those standards in place. So that will make a huge difference in terms of some of the stuff I think we were seeing. but also social housing. I mean, certainly where I am down south, the previous government had sold off a huge number of our state houses. We've got an acute crisis in terms of those that are in need of social housing. And so one of the first things we did in government, and it's across the country, is we stopped the large-scale sell-off of state houses. And then we've committed to building new ones. And so in budget 2018, there was funding for a package for 6,400 more new public houses to be built over the next 4 years. So instead of that constant sell-off, shrinking state housing stock, really investing and moving forward in terms of expanding that again and making sure that we're looking at quality. So again, this will take time to bed in, but I think we've basically made the start and we're moving forward with that investment. And so some of the other things that we're doing, child poverty reduction. So child poverty is about income and it's about decent housing, but it's also about making sure that we're very clear about what's happening in terms of transparency of how we're going moving forward on child poverty. And so what we've legislated, the Child Poverty Reduction Bill came in 2018, and that set in place a whole set of indicators for measuring child poverty, and also long-term 10-year and intermediate-term 3-year targets, so that everybody's very aware of where we are in terms of child poverty and what the government's doing about it. And the other thing that's really quite important, I was talking to Amanda about it before, is this little document here. Because if you think back to what happened in 1991, when they did all those things like cutting the benefits and all that raft of legislation coming forward, nobody ever stopped to think about what impact that would have on families and children. And so legislated in this act is that every budget day, the government has to report how the budget will reduce child poverty and how the government's progressing on those targets, so that you've actually explicitly got to think about what you're doing in that budget. And so this is just the one that came out with the most recent budget. And it basically goes through where we are in terms of some of our child poverty indicators, and also talks explicitly about what this budget is doing to address the issue. And I think having that legislated in is actually incredibly important. And we've also, the Children's Amendment Act that went through at the same time just got split off later in the debate intentionally. Basically what it does is requires successive governments to develop and publish a strategy to improve the wellbeing of children and young people. And that also just came out recently. It's available online, and I believe some of the people in the room were part of some of those working groups to think about where we go in this. And this is deliberately a strategy that's across sectors that looks at a whole range of measures for child wellbeing, and it is available online. I can give you the references and things later. But what it basically does is make sure that these issues remain in the public consciousness, and there's legislation in place to ensure that occurs, which hadn't happened up until now. And I think would have made a big difference, back in the early 90s, had that been a requirement. So this is just the overall framework that looks across a range of areas, and that's part of that strategy that's just recently come out. And so it probably won't go into it now because I'm just aware of time. But that's basically another key measure that we've got. The other one we've, as a government, moving on, which wasn't something that I'd been focusing on prior to entering Parliament, but is something that subsequently became very apparent to many people across our country, is the whole issue of mental health. And so the government's also putting a huge investment into mental health. And so the recently released report from the Inquiry into Mental Health and Addiction, which travelled the country talking about people's needs, came up with a whole lot of recommendations, and the government has responded in terms of how we are going to be addressing those issues, and also put 1.9 billion of investment into this year's budget in terms of implementing a lot of those changes, and also recently releasing Every Life Matters, which is looking at our suicide prevention strategy moving forward. So again, these are very recent, in the last few months and even the last few weeks, announcements of where we're going. And also the Cancer Action Plan is just something we've also released recently, talking about how we basically improve our cancer outcomes. And so basically a whole range of initiatives in that, with basically looking at extra funding for pharmac, because this has become an issue in terms of how we resource those medications for people. Also speeding up pharmac's decision-making process, and also establishing a cancer control agency, which will look at how we, make sure we've got consistent cancer care across the country. And then basically we've also, in the room here, we have the new director of cancer control. So again, having a major contribution from this room in terms of taking that leadership forward in terms of public health. So congratulations on your appointment as the interim director. A big challenge. So basically, just moving forward and then thinking through how we develop up those consistent quality performance indicators. So there's basically a whole lot of action that's going to be happening in that area, and I'm sure Diana's going to be taking, it's going to be an interesting challenge, but I think, with having that expertise and that, previous understanding of the sector, I think it's going to be great moving forward with your leadership. So moving forward, that's probably a quick rattle through where we're at in terms of a range of initiatives. But just thinking through, coming back to the role of those in this room in terms of the health sector experience, that research and that advocacy, it's really, really important, because I think as we move forward, as politicians, as government, we rely on that research being done, about that clarity about what those next steps are moving forward. And having that research and evidence base behind it is crucially important. So I'll leave it there, and just any questions. We've probably got 5 minutes. All good? Okay. Otherwise, I'll.
I didn't have a question. I just wanted to say, Liz, it's fantastic to hear evidence translating into policy, because in many governments around the world, and sometimes previous iterations of the government in New Zealand, one could say, there has been evidence, but that hasn't actually translated into action. And so it's really encouraging that there's data being analysed, and that is informing policy. So that's really, really encouraging for all of us who have an interest in public health.
Thanks, Andrew.
That wonderful speech. My name's Mary Moore. I'm a nurse, a registered nurse. I'm currently not working, but I was in Canada in January, and something that surprised me that they do over there that helps families is in the province of Ontario, all essential food items like fruit, vegetables, not so much meat, are tax-free.
Right.
Which I think is a wonderful idea, because I think it's a shame that Coca-Cola costs less than milk.
Yeah, and I think that's, those issues have been suggested, for quite some time. And I guess what we've done so far is making sure that families do have enough income so that they can then go out and make those healthy choices, because I think that's the issue, where if you're stretched on income, thinking through what's cheap and what's available. That's something that I think, thinking forward, may well be something considering the future. But at the moment, what we have focused on is just making sure that we can get that income into families that need it, to start with as a first step. Yeah.
You're on Neville from the Healthy Housing Research Group. Okay, can you hear me? No. Okay. Neville from the Healthy Housing Research Group. Thanks very much for the presentation, Liz. I guess one of the things that strikes me about the 1990s increase in child poverty is largely driven by a decrease in the state, the size of the state. And Labour has, and the coalition government has kind of bound itself up in fiscal rules. And, does that kind of limit the ability to move, and because you've such a small envelope to change things?
Well, I think that's something that that Grant, as Minister of Finance, has signalled that there may be just some of the modifications to the range in terms of some of those constraints. But I think it's also important that we do maintain responsible, fiscally responsible as we move forward. I mean, how we, the decisions that we made at the last election when there were tax cuts on offer, is that what we said is how we would fund our initiatives would be to, one, not do tax cuts, because we believe that that money would be better spent, invested in health, education, housing, but two, have a slightly slower debt payment trajectory so that we could then have that room to do what we need to do. And so I think that's where that's where the difference came in terms of those policy choices back at the election, but then also thinking about that range moving forward. But we do still have to make sure that we are doing that in a fiscally responsible way.
The other way, remember that organisations like Housing New Zealand have been enabled to put out wellbeing bonds, sort of 1.4 billion. So there's a different way which money can be raised across state activities, not necessarily through central government.
Hi, my name's Aisha Verrill. Thank you, Liz, for your talk. Really inspirational. Just wondered if you could comment on the strengths and weaknesses of government transfers to people, for example, through benefit systems versus service provision, for example, institutional housing, state provision of housing, and what you see the strengths of those approaches, different approaches for alleviating poverty.
I mean, I think we probably need the mixture of both, and I think that's where we have been trying to focus on both. So in terms of those income transfers, that's where what we thought with that Best Start payment is what the research suggests is if a child's growing up in poverty, it's those first 5 years that are most important. And so that's why we put that $60 a week Best Start into those first 3 years, because I think we thought that made the difference. But we've also got to look at, and this is where we're focusing on minimum wage as well. Because if you're looking at how you transition off, say, benefit into working, then what you need to be able to do is earn enough to actually see yourself above what you would earn on benefit. And I think if that's at a very low minimum wage, then you've got issues there. So that's one of the other reasons why we've looked at, looking at minimum wage, making sure that that's adequate. But also the whole cost of housing, which is, incredibly huge impact on lots of families' budgets. And so again, looking at the social housing in that spectrum, that's why we're getting on and trying to invest back into rebuilding those houses, because it's not just about purchasing houses already existing. We've actually got to get on and build new houses, and particularly where I am based in Invercargill, we've just lost so many state houses that it's important to get in and build those again. And because so much of families' income is going on that and being able to access, there. But I think it's a principle of you need a range of policies that all come together to actually look at family wellbeing, and you need both sides.
I've got a quick question, Amanda D'Souza. I'm just interested in your reflections on whether you feel that you are able to be more effective in producing change as a politician compared to advocating from the outside.
Yeah, I think probably thinking about being able to shape the policy direction of where we're going in terms of, and I think that's where the conversation happens. And I think thinking about the roles of you guys in this room and sort of me in Parliament, I think that's probably where we need to be thinking and focusing on. My reflection, I think, is after 10 years of doing that advocacy, and I guess being frustrated about how long it was taking, I did make the jump. And I think it has been good to be able to still have those conversations with the relevant people and, say, we thought about this or that. But I thought, when I started out in that advocacy role, we'd have it done and dusted short. And it took 10 years even just to get through to being able to get that information out in a systematic way. So I think the learning curve for being a new MP is quite significant. And I'm hoping that if I look back on, a career after, a number of years, I'll be able to answer that question. But right now it's just, yeah.
I think that's a good note to end.
Yeah.
Evaluating her own
Yeah, ask me in 10 years. Cool. Okay, well, I'll be around for a few minutes, so thank you. Okay.
Thank you for your contribution, both of the Child Poverty Monitor and work with that, and also your energy that you brought to your parliamentary position. And thanks for sharing your insights.
Cool. Thanks. And I will be around if people want to catch up afterwards. No, because I presented somewhere else.